Most people don't understand diabetes or don't understand several elements. This is Pharmacist George, and I'm on a mission to help you regain total control of diabetes, win with diabetes, and possibly reverse it. So, first, in my 35 plus years of pharmacy practice, I have realized that most people don't understand diabetes or don't understand several elements that contribute to complications. So I'm here to tell you every step, every issue about diabetes so you can regain control and you can possibly reverse it. First, what is diabetes? And then what type of diabetes there are. So diabetes is the inability of the person with diabetes to be able to handle the sugar or the carbohydrates that are being taken in to the body and then store them in the muscle. In some cases, insulin is being produced but is not able to perform its function totally. First, let's start with the different types of diabetes. There's type 1 diabetes and type 2 diabetes. Type 1 diabetes is not lifestyle related and it's considered an autoimmune disease. By that I mean when the body turns onto itself and the immune cells or the white blood cells start attacking the beta cells in the pancreas, and the beta cells are the ones that produce insulin. So those immune cells, they attack beta cells until they're absolutely gone. People with type 1 diabetes are diagnosed when they're little, like 4 or 5 years old, although during my pharmacy practice, I have encountered people who are diagnosed with type 1 at a later stage when they are 16, 18, or even 21. Those people diagnosed with type 1 diabetes, they have to depend on insulin the rest of their life because their bodies don't produce insulin. On the other hand, type 2 diabetes is technically lifestyle related and also has a family history component. But the family history component on its own is not enough. There is a family tendency, but what triggers diabetes is the lifestyle of that person. What causes some of those problems to be shown or to trigger diabetes is physical inactivity, excess weight, faulty lifestyle choices. I've noticed that all these choices are made by people who have this condition, and that is detrimental, and that's not going to help the person regain control. So in future posts, I'm going to give you all the tools you need to understand the food choices aspect about it, to help stimulate your insulin, to be responsive better, and all the various factors. And in type 2 diabetes, there's also a couple of components. One is prediabetes, which is a precursor to diabetes. And in later posts, I will tell you what the sugar levels are. So prediabetes is a stage that leads you to diabetes, and it can be fully reversed. So you have the chance to reverse type 2 diabetes and also prediabetes. And there's also another component of type 2 diabetes, which is gestational diabetes. And this is where the woman who's bearing a child will be diagnosed with type 2 diabetes. And at the end after the delivery and after the pregnancy is gone, the blood levels regain to normal. And then that person will not have diabetes anymore. Although 50% of those women can develop full-blown diabetes later in life if they don't pay attention and if they don't make the right choices, and especially if they have the family history. So to know more about this, go to my website at the link, and it's www.winningwithdiabetesandprediabetes.com, and I will see you in the next post.